Hi guys, Olivia here at OSSPT. Today we're going to be talking about some breathing exercises. As most of you know and have heard about coronavirus or COVID-19, it is a virus that has been kind of greatly affecting our communities over the last couple weeks and months. Coronavirus as a whole is a respiratory disease that, if it progresses, can affect the lungs and lead to breathing trouble. Although the CDC says 80% of individuals who contract the virus recover quickly and have only mild symptoms, if the virus does spread and progress, it can lead to pneumonia and other lung infections, resulting in hospitalization and ventilation. Though breathing exercises cannot prevent COVID and do not cure it, it is our goal here to talk about some exercises that can help benefit both the healthy population and those with mild symptoms. Just a reminder, if you are suffering from shortness of breath or severe respiratory distress, issues breathing, please contact your PCP or your local ER and see how they can help you with that. The goal of the exercises that we're discussing today are to help individuals both be intentional about their breathing and as well as just calming anxiety whenever breathing can be difficult or any other situation where you find it hard to catch your breath. The goal is also to help maximize the effectiveness of each breath taken to make sure we help get the oxygen to the necessary organs and tissues. There are two types of breathing that we're going to discuss today. The first one is quiet breathing. That is our normal, everyday, chilling on the couch, watching Netflix breathing that you don't have to think too much about. The diaphragm does most of the work for us during this type of breathing. Another type of breathing is after we work out, after we're running up and down the hallway, or just from those individuals that are having issues catching their breath. It's a little bit more of a laborious task to get air into the lungs. When that is the case, we actually recruit other muscles besides the diaphragm to help us breathe, including our neck muscles, our chest muscles, and our back muscles. So the two breathing exercises we are going to demonstrate and discuss today include diaphragmatic breathing and tripod breathing. So diaphragmatic breathing, again, is kind of related to our quiet breathing, not laborious in any way. It's also known as belly breathing. So the idea here is to help expand the belly to create more room for air to come into the lungs and making sure we're not using our chest quite as much. So when we do this, we're actually going to lay flat, okay? And what I like to do is place one hand on my stomach to watch my hand go up towards the ceiling whenever I'm breathing in, and then place one hand on my chest to make sure that this hand is not moving as much because I don't want my chest moving very much. We're also going to add in a tempo to this breathing. Helps control the breathing and helps control that mind-body connection. So we're going to be breathing in for a count of 4, then we're going to hold that breath for a count of 7, and then we're going to exhale for a count of 8. Okay? So I'll demonstrate that now. Again, we always want to lay flat on a good surface. Make sure your head is supported and knees are up. Okay? One hand on the chest, one hand on the belly. Okay? And as we breathe in, I'm going to be counting while I'm breathing in. So 1, 2, 3, 4. And we're going to hold for 1, 2, 3, 4, 5, 6, 7. And then we're going to exhale for 8. 1, 2, 3, 4, 5, 6, 7, 8. Okay. Pretty simple. Again, the idea here is to help control the breathing and control the mind while we are being intentional with our breath. The other type of breathing that we're going to discuss is called tripod breathing. This is actually for those who are having difficulty breathing, difficulty catching their breath, whatever the case may be, okay? It's exactly how it sounds. We're going to form a tripod with our body. We're going to fix both our hands on our knees or a surface in front of you, whatever works best. When we fix our upper extremities on a surface, it helps us recruit those accessory muscles we were discussing earlier, including our neck, our chest, and our back muscles. So here, take some deep breaths. And again, the idea here is to try to get to the point where you can do the 4-7-8 pattern as well. However, that can be really difficult for those who are having difficulty breathing. If that's the case, we're going to try to do 2-2, so 2 in, 2 out. Basically, the goal is to try to prevent falling into a state of hyperventilation or rapid breathing. And lastly, another factor we really need to consider when we're talking about respiration is hydration. If we're dehydrated, the blood can get really thick. It makes it difficult to flow throughout the body, and therefore makes it difficult to supply oxygen to the necessary organs and tissues. So make sure you drink plenty of water throughout the day. Again, this is not meant to cure or prevent COVID-19. If you are experiencing the symptoms of COVID, including a fever, coughing, a dry cough, shortness of breath, or difficulty breathing, please contact your PCP or your local COVID hotline. Thank you guys so much for checking in, and we'll see you next time.